Motion Chiropractic in Milford, Ohio. In today's video we're going to talk about some common questions that patients sometimes bring up about their health and if chiropractic can help that. One common question is patients come in, they've seen their medical doctor who has diagnosed them with possibly degenerative changes in their spine, and patients want to know if chiropractic can help with that. The answer is absolutely. Obviously it depends kind of along how many degenerative changes or how long that's existed and how far it's progressed. But basically the phrase degenerative changes refers to osteoarthritis, or OA is commonly called. Most commonly it's found in the neck and low back, and it's the most common form of arthritis. Basically in osteoarthritis, the spaces between the vertebrae, they basically narrow and possibly then bone spurs form. This basically creates inflammation in the area, causing muscles and joints to be painful and sore. And then gradually with time, the joints and the spine becomes less flexible and becomes very stiff and painful. So the medical approach with this typically would be to prescribe some different drugs, some maybe pain relievers, some anti-inflammatory drugs to help calm inflammation down in the area. Chiropractic approach quite a bit different. Essentially we want to identify any areas of restriction in the spine. So any areas of the spine that aren't moving like they should be, they're tight and fixated. And then two, obviously to find out why those areas are restricted in the spine. Usually imbalances exist that create uneven stress in the spine that then create the prematurely break down and have those degenerative changes. So the chiropractic approach would be to identify those. We adjust those areas, which means to create movement through the joints. And then once the patient is ready, to give the appropriate exercises to strengthen the area and protect it from breaking down further. Also, since chiropractic takes a more holistic approach, we'd also want to identify any other issues going on that might be at least contributing to osteoarthritis. One would be hydration. Water is extremely important to the health and well-being of your body. If you think about it, most Americans are dehydrated to some degree. This is going to cause cartilage to potentially break down. Cartilage is mostly water. To protect those joints, you think about inside the joints there's fluid to help keep movement the way it should be, and basically lubricate the joints. And so even small changes in hydration can affect that. And I think it's important that we also look at that for the overall health of the person. Not to mention, there's definitely plenty of anti-inflammatory things out there that are just good for the body. One of those would be things like bromelain, turmeric. Also have other health benefits as well. You look at fish oil, has anti-inflammatory benefits. Not to mention omega-3s is great for your nervous system. So that's more of the chiropractic approach to osteoarthritis. Like I said, there are instances where it's progressed past where maybe we could make big changes for the patient, but it's definitely worth getting examined and getting a second opinion as well. So either way, if you'd like more information about Living with Motion Chiropractic, you can go to our website at www.livingwithmotion.com, or of course give us a call and come in for a consultation. Number is area code 513-831-4433. We'd like to talk to you. Thanks. I'd like to thank you for watching our video on YouTube. I hope you enjoyed it and learned something about chiropractic and how chiropractic can possibly help you with your condition. Whether it's regarding arthritis or not, we'd love to talk to you and see if chiropractic's the right treatment for you. Thanks.